Good morning, Steve Bisson here. I was going to talk more about anxiety today due to part three, but I'm actually going to address a little bit of trauma because of the events in Beirut, Pakistan, Paris, and right now one in Mali. I just figured we'd talk a little bit about trauma because it does affect us all. One of the things that trauma does is that it releases a hormone called oxytocin, and sometimes when you've been through other traumas, people react even more because that oxytocin kind of like triggers other memories in your body. I know it sounds a little out there, but biologically speaking, it makes perfect sense. So, how do we deal with trauma? There's a few ways to really deal with the trauma. I think you got to live your emotions. One of the things that people tend to do is that you got to be strong, you can't be sad, you can't be upset. Well, frankly, there's no right way to deal with emotions. Um, it's living him too strongly or trying to bury him that probably is the only two things I wouldn't recommend. Otherwise, you got to live your emotions. The other thing too is that you need to also find a way to heal yourself, and you can heal yourself in different ways. Maybe you can help out in your community. Maybe you can do other things. But I would say that healing is very important. So sending money, giving blood, all things that happen after traumatic events in the United States recently, and of course in the other parts of the world. Um, so I would think about doing that. The other final thing I would say to you is that don't judge people. Um, some people are not affected at all by all these attacks across the world, and that's okay. That's their right. They don't have to feel everything you feel, but you're allowed to feel whatever you want to feel, and that's also important. So if the Paris attacks really touched you, it's okay. You don't need to expect everyone to be touched the same way as you, and that's what trauma does. Everyone thinks that their trauma has to be the same from one person to another. People deal with trauma differently. So those are a couple of tips. We'll talk more about anxiety and or trauma next week. I just want to make sure we did that today. It was very important. Um, Thank you for those of you who know I have some friends who have family members and friends out in Paris. Everyone's okay. I did not know anyone in Lebanon, Mali, or Pakistan, but certainly there for them too. Um, so I appreciate the time you just gave me. Notes, comments, obviously add them to here, and I'll talk to you next week. If you don't get this message until the next Friday, maybe I missed it, but happy Thanksgiving.